Psychotherapies. And while we're waiting for a few other people to trickle in, what I want you to do is you to take a moment and answer a very simple question, and it's also a very profound question. And this is a private answer. Who am I? In fact, I saw a book out in the lobby titled Who Am I? And this is the heart of many meditation techniques, focusing just on this one singular question. So either taking paper and pencils, I noticed there's notepads on your desk, tables, or alternatively just in your own mind. How would you answer verbally, who am I? And we'll just take a couple of moments to let you reflect to set the mood for the presentation. And as a few people trickle in, I pose the question, who am I? For everybody to reflect on privately for just a few moments. And while y'all are answering that question, for those who are participating, I want to share a little bit about my background in terms of talking about this subject. I'm a retired professor of psychology at the University of Florida in the United States, as well as a professor emeritus at Saybrook University. And I'm also a long-time researcher and writer in the area of transpersonal psychology. And currently I'm working on two handbooks. One, a handbook of transpersonal psychology with Wiley Blackwell, and another with Prager on a handbook of applied transpersonal psychology. So I'm also the senior editor of a journal, the International Journal of Transpersonal Studies, which is available online free if any of you want to delve into some of the transpersonal literature. And with that said, let's move into the presentation. I might mention my email address if any of you want to contact me for the presentation or for other details. So asking this question, who am I, has a long tradition in psychology and sociology. Goes back actually to the 1930s. And there's a test called the 20 Statements Test, where people were asked this very question, and their responses were analyzed using various thematic categories. And one of the things that was noticed is that in Western cultures, most people gave as their center of identity who they are as characteristics of their individual self. I am a short individual. I am a male. I am an academician. Traits that define themselves as individuals. A lot of people also define themselves relationally. I'm a husband. I'm a father. I'm a grandfather. Those are the most common answers. But sometimes people define themselves in ways that might be seen as deeper or more meaningful, such as I'm a child of the God, or a child of the universe, or I'm a spiritual being, or I'm a being that exists in space and time without boundaries. And these sorts of answers, though not so typical, generally can be evoked if we ask people to use what's called an onion test, and to take their answers to the who am I question and to break it down in terms of what is more superficial at the outer rim of the onion and what is more central to them at the core of the onion. And when people are asked to do exercises like that, to go to the more deeper, the more profound, the more meaningful part of how they identify themselves, then usually these transpersonal and spiritual items start emerging as being the most central parts of identity. And issues such as I'm the owner of a brand new car, or I'm in a relationship with somebody, seem to not be essential. So one of the ways to look at the transpersonal, and it's a term that many of you may not have heard of, is to look at it in terms of the boundaries of the self, and as a movement, the transpersonal movement, to challenge the myth of the isolated individual. And this is a very predominant motif in Western culture, that we see ourselves as isolated in control, master of our own ship, in charge of our own destiny, but the reality is none of us is isolated. Each one of us is part of systems within systems within systems, and in fact each one of us is composed of systems that are composed of smaller systems, etc. So there's a continuity there. So this level of the human person, the human being, particularly as we identify with it in terms of ego, the ways that we attempt to give coherence and meaning and structure cognitively, can be deconstructed and seen as very arbitrary. So to contextualize transpersonal psychology, of which transpersonal psychotherapies is one application, first, this arose in the 1960s as a movement, and one of the major forces was multiculturalism. And I'm thinking of one of my mentors who supervised my doctoral dissertation, and he was the adjutant to General McCarthy in Japan post-World War II. And he began to practice Zen Buddhism, and when he came back to the States, he got his doctorate in psychology, but he was very influenced by the practice of Buddhism, and that swayed his entire approach to psychology. So many people began to become exposed post-World War II to other cultures, and not in a denigrating way, not looking at it from just a Western-centered approach that the Western culture is best and other cultures are primitives or savages, but looking at it in terms of what we could truly learn from other cultures. Also, during the 1960s, there was a lot of social unrest. People started becoming aware of ecological crises. There were civil rights movements. There were anti-war movements. Essentially, there was a lot of questioning of authority. In addition to the social movements that led to the advent of transpersonal psychology, many people began to experiment with psychedelics. And instead of just reading about or hearing about altered states of consciousness and other unusual phenomena that we associate with transpersonal, people began to have their direct and immediate experiences of alternate states of consciousness. And all of this was happening at a time where religion and spirituality were taboo subjects in the field of psychology. Ever since the time of Freud, to talk about religion and spirituality was seen as letting the camel put its nose under the tent. This was very threatening because psychology in particular was trying to portray itself as a science and divorce itself from any other influences that could be seen as mystical or supernatural or in any other way be anti-evolutionary rather than evolutionary, progressing toward a science. In terms of the use of the term transpersonal, some of Jung's early works back in the 1930s when they were translated into English used that term, so those are the first known usages of the term. So to unpack the definition of transpersonal psychology a little bit, focusing on the word trans, and there are two major meanings of the word trans that the transpersonalists focus on to try to give some meaning to the term. The first is beyond, that somehow the word trans refers to whatever is beyond the personal, and oftentimes it's referred to things that were seen as transcendent or above the material plane, something that was supernatural, similar to notions of God or the ultimate reality seen in a spiritual way. But later, transpersonal also began to be related to the notion of interconnectedness, the fact that we all are parts of an interconnected web of systems into systems into systems. Later, transpersonal psychology became more interested also in transformation and became a transformative discipline, not just at the individual level, but also at the sociocultural level. And there are a couple of key issues with transpersonal psychology. One is it doesn't limit itself just to a materialistic view of the world. So instead of looking at the world just as composed of matter and looking at causation as being from the bottom toward up, such as looking at psychology as being ultimately better explained by biology, and biology ultimately being better explained by chemistry, and chemistry by physics ad nauseum. Instead, looking at it holistically with top-down as well as bottom-up types of explanations, and also considering larger possible higher ultimate explanations, such as in different spiritual systems. It's important, though, to differentiate spirituality and religion from transpersonal psychology. And this is a very tricky area, and both of the speakers who spoke before me focused on the centrality of spirituality in their talks, or at least touched upon that. And with religiosity and spirituality, these are kind of complementary terms, two sides of the same coin. Religiosity referring to the external expressions, such as rituals and beliefs that are shared within a community that express some sense of sacredness or relatedness to what is sacred. And then the spirituality referring more to the actual inner experience. And traditionally, religion and spirituality have been yoked together, that people got their spiritual understandings through their religion. But one of the interesting things that's happening with modernism is a lot of people are discarding the religions of their traditions, but still holding on to their spirituality and saying, yes, I have my spiritual experiences, but it doesn't fit into a container such as Christianity or other religions. In fact, many people, in trying to make meaning of what is most important to them, their spirituality, will often focus on religions that are foreign to them, such as the fact that in the West, there's a large number of people converting to Buddhism, looking for a deeper, more meaningful truth. Interesting to note, however, that in a lot of the Eastern cultures, the exact opposite is happening. I recently wrote a paper on demographic shifts in South Korea, where a large number of people are converting to Christianity because they see their Buddhism as lacking meaning. They're tired of the corruption of the Buddhist establishment, and they read the New Testament and get inspired. This is something real and refreshing. And so just as in the West, there's a lot of conversion to Eastern religions, in the East, the opposite process is paradoxically occurring. One way to get a grasp on this issue of transpersonal psychology is to focus on Abe Maslow's work. And Maslow is one of the founders of a movement in psychology called humanistic psychology. And among the humanistic people, existential and phenomenological approaches are considered a main branch of the existential, focusing on people and how people relate to important aspects of their lives. But Maslow said we need to get away from being human-centered and we need to be more cosmic or cosmos-centered. So Maslow essentially, for the end of his career, abandoned or went beyond what he helped found, humanistic psychology, and was one of the forerunners and founders of transpersonal psychology. So in terms of applying this to psychotherapy or therapia, the healing, which is not just necessarily a healing of DSM or ICD diagnostic categories of mental illness, but a healing that's more holistic, more broad. First, we have to look at assessment. If you're going to try to do some sort of intervention with a person or a group, you have to have some idea of what's going on with them currently and some idea as to where you might want to lead them. So that means an assessment. And so assessment and therapy are intertwined, and even people who are very humanistic and existential and might eschew all sorts of assessments still all professional activities involve evaluation. Somehow we're always sizing people up, whether we do it as a formal assessment or whether we do it just as our intuitive working with people. So in terms of testing and diagnosis, these are often very loaded terms for people who gravitate toward existential and humanistic approaches to psychotherapy. And I want to make sure that it's delineated properly, that assessment does not necessarily mean testing. There can be qualitative assessments without using standardized psychometric measures. And there can also be qualitative assessments that use measures such as projective techniques that don't end up in some sort of a number that puts a person on some normative scale. And then likewise with assessment, there doesn't have to necessarily be a label, a diagnosis. There can also be all sorts of ways to summarize the evaluation, say in a narrative report or whatever, or just in terms of the therapist's construction of what might be going on with a person or a group that they're working with. I've done a lot of writing in the area of transpersonal assessment, and one of the things that I've done is I've summarized over 100 measures of spiritual and transpersonal measures and compared and contrasted what they're trying to do. And the bottom line is that there's a lot of different views of the transpersonal and the spiritual, not a lot of overlap, and it's still a very muddled concept. And we tend to gravitate toward it as if it's the most meaningful thing for us, but there's very little consensual understanding. A good friend of mine, a colleague, Doug McDonald, has taken a large number of spiritual and transpersonal measures and administered them to a group of students who must have been very patient because they had to take like 5 or 6 hours of different paper and pencil tests. And then Doug put this through a process called factor analysis, and he came up with a 5-factor approach to organize these constructs. But I don't think that really gets deeper to what's going on with them as much as it organizes all of the attempts that we have to try to make sense of the spiritual and the transpersonal. One area that interests me a lot that I'll just mention in passing is enlightened versus delusional, and how many people who have severe psychopathology couch that psychopathology in religious, spiritual, or transpersonal terms. So it's very difficult to differentiate whether a person might be psychotic or might be very spiritually, transpersonally gifted. And if you look at the lives of certain mystics, you can draw similar conclusions. I'm thinking of the renowned saint or revered saint from India, Ramana Maharshi, who, from external accounts, would be seen as a schizophrenic homeless person in his youth. But in India, rather than being institutionalized and maybe subjected to electric shock or other techniques that we use in our society to help people, he instead was revered for his closeness to God and his spirituality, and quite a different outcome based on the cultural context. I'm putting near-death experiences up here as just one example of transpersonal experiences that clinicians often have to deal with, because these are very common. So near-death experiences are often romanticized as wonderful. I'm sure everybody's heard of people being declared clinically dead and coming back and saying they cavorted with angels and they went through the tunnel and met all their past relatives and only came back begrudgingly because it was so beautiful it was hard to let go. Well, that does happen to a lot of people and can be a major source of meaning-making. But also a lot of people who have experienced near-death have serious consequences to that experience. increased depression, anxiety, feeling like folks don't understand them. They have greatly increased rates of divorce, career changes. Often it takes people years and years to somehow make meaning of such a powerful experience. And oftentimes when folks with near-death experiences come into the clutches of mental health professionals, their experiences are forced into very narrow categories. And this can often be very iatrogenic or harm caused by the professional relationship. So this is one example of where a little bit more of an understanding of transpersonal psychology and applying it could be very useful. So there are many types of transpersonal therapies, and one thing I'll say is that most of the therapies that I would call transpersonal don't use that term at all. You know, they might meet my criteria or the criterion of other transpersonal psychologists, but the people who are doing them and writing them would never see them that way. And I'm thinking of such as meditation. Back in the 1960s, to talk about meditation was really to talk about something that was seen as an attempt to regress back to the infantile from a Freudian perspective, or to avoid life, to be a denial mechanism. But nowadays, meditation is pretty mainstream, and not many people look at it in terms of transpersonal psychology. But the original articles written on meditation in the psychology literature were published in the Journal of Transpersonal Psychology in the 60s. So we've gone on to forget the roots of a lot of this. And one thing I'll mention also is the area of mindfulness, which has just skyrocketed, paralleling the skyrocketing of positive psychology. And how many people have glommed on to, mindfulness for treating test anxiety, mindfulness for treating dog phobias, mindfulness for treating just about everything. And one thing that concerns me a lot, I've been writing a lot about this, is people often will attribute mindfulness to the Buddhist tradition. And it's true. Mindfulness is found in a number of varieties of Buddhism, like the Theravadan tradition. But mindfulness has a much longer, deeper history than that. Freud used to talk about the therapeutic attitude and training psychoanalysts to have evenly hovering attention and to be mindful, essentially, so that they would be open to the reality of the analysand, the person being analyzed. So, and where did Freud get this? He got this from the Jewish Kabbalistic tradition, where a lot of Freud's work stemmed, although this often isn't given proper attribution. A lot of Freud's work with, say, dream interpretation has a long history in Jewish mysticism of the Kabbalah. So there are many techniques from many religious and spiritual traditions, and one that I'll mention in my last slide, or in my last sentence on this slide, is from shamanism that are transpersonal, such as using different techniques to deal with dissociated states. And these types of techniques probably go back to the earliest hominid ancestors 50,000 or more years ago. So in a sense, dealing with transpersonal psychotherapies is both going back as well as going forward. So I want to go over a number of techniques that are utilized in transpersonal psychotherapy. And one thing that I'll say is that technique doesn't necessarily describe the transpersonal, but the focus of these techniques is to bring a person into an experience of something that is more, that's trans, whether it's their own interconnectedness or whether their relationship in terms of beyondness. So one is the attentional approaches, and training people to pay attention in different ways. And essentially this means altering consciousness. But from a transpersonal perspective, we're not really talking about altering consciousness from some sort of baseline of health and normalcy, but the fact that there's many varieties of consciousness, and within certain cultures, we have a very narrow focus that we attend to. And that's considered normative in our society, and we don't pay attention to a lot of other things that's happening, such as maybe would be seen as spiritual or transcendent. So there are a variety of ways of working with consciousness attentionally. One of them is hypnosis, and using hypnosis to guide people's attention into areas where maybe ordinarily they would not attend, or encouraging people to learn how to self-guide. Meditation can be seen as an attentional altering strategy. Prayer also, a variety of imagery. And one of the things that I think is very interesting, I'll talk a little bit more about that, is new technologies that are emerging that are giving us abilities to alter attention in more effective and efficient ways than ever before. I might also add that for the attentional, hypnosis done for an ordinary purpose, such as to help a person develop an aversion to cigarettes so that hopefully they won't continue to smoke, I wouldn't see that as transpersonal. But hypnosis that allows a person to have a regressive experience into deep parts of their so-called unconscious and get in touch with spiritual issues and issues that go beyond the ordinary, that would be transpersonal. This is a very controversial area, the use of chemistry to alter consciousness. And it's already discussed today how SSRIs often are used to restrict or constrict consciousness and essentially deaden a person. But there's a whole range of chemicals out there that do quite the opposite. They expand consciousness. And in our society, which is considered to be a monophasic society, essentially we make a delineation only between normal waking consciousness and sleepfulness, as opposed to, say, I'm thinking of the Tibetan language, where there are literally thousands of states of consciousness that have names for them, and that people learn to navigate from or among. But in our society, we hardly recognize the variety of states of consciousness. And if a child is wandering into daydreaming, we call them attention deficit, and we're going to give them psychostimulants to perk them up, to make sure that they do pay attention to what we consider valuable in our society, rather than going off into maybe some more creative and ecstatic types of experiences. And by saying that, I also want to say that I'm not denying that there are many people whose lives are really hurt by attention deficit disorder, as we label it. But the fact that we've got over 10% of the kids in the U.S. on these powerful psychostimulant medications that stunt growth, that's one of my pet peeves. So, and this all has to do with consciousness. So in terms of the biochemical approaches, many people have very powerful spiritual and other experiences through chemicals, and this is nothing new. This seems to be a cultural invariant, just like we've never found a group of people that didn't use language, or a group of people that didn't do something with their bodies to adorn them in some ways, or put clothes on or something. We've never found a group of people that didn't alter their consciousness by some sort of plant or animal or other substances. So from the earliest times, people have been playing around with these powerful substances. And I might note that I'm very interested right now in doing some research with one substance called ketamine. And to give you a sense of this, in very small dosages, ketamine seems to be a mild antidepressant. And there are studies coming out right now in Johns Hopkins that people given small dosages of ketamine, if they're in so-called treatment-resistant depression, will almost immediately respond, whereas the SSRIs take about 2 weeks to deaden you to the pain. So in larger dosages, ketamine appears to be somewhat of a euphoric. In even larger dosages, ketamine becomes a psychedelic. In larger dosages than that, it becomes a very powerful mind-altering substance, much more powerful than LSD. And even larger dosages than that, it becomes a dissociative anesthetic. And at the psychedelic range of ketamine, people will often have very powerful mystical experiences. And I've been working with a fellow named Krupitsky in Russia. I don't know if anybody's heard of his work, but he's administered ketamine to tens of thousands of people in Russia, primarily for alcoholism and heroin abuse. And he's getting amazing results, like 80% success that people are staying off these highly addictive substances for a year. And it's not just the ketamine, the substance, but it's that people, when they go on these trips, they have very meaningful spiritual experiences. Essentially, it mimics a near-death experience. So we're trying to, I have a team in Florida, we're trying to replicate this with in America. And one of the things that's very interesting about ketamine, there's been this war on drugs, and it's really hard to get permits to use LSD or psilocybin or all of these other psychedelics. But ketamine is used all the time as an anesthetic, so it's been approved by all the government agencies in America and other Western states as relatively safe. So any physician can prescribe it off-label. So it's readily available for use for transpersonal purposes. So depth psychological is another approach that I would consider to be transpersonal, and probably relate this most to the work of Jung, who got into the collective unconscious and deep psychic archetypes and all of that sorts of stuff is transpersonal. And I might mention that Jung also, as I mentioned earlier, was one of the first to use that term, although he used it not in English, it was translated that way in English. Another influential figure from the depth psychological approach that I would call transpersonal is Assagioli. And he basically was a pretty traditional Freudian who did a conventional psychoanalysis working on individuals' personal issues, but then he said, well, that's not enough. We need to go further. And after doing the psychoanalysis, he wanted to put it together in a psychosynthesis. And the psychosynthesis was very much transpersonal, focusing on issues like interconnectedness and transcendence. Somatic approaches is another one. And using the body to alter consciousness, whether it be through fasting or through rhythmic movements or through exposure to light, photic stimulation of different sorts, a variety of ways. Stan Grof was one of the leading transpersonal researchers back in the 60s, and he administered LSD to thousands of people at the University of Maryland and did great empirical research on what the effects of these were, and the results were amazing, including one of the most undervalued psychologists of recent times, Timothy Leary at Harvard, who did wonderfully creative work, even though later in his life, Richard Nixon called him the world's most dangerous criminal. But with that said, as LSD and other means to explore transpersonal phenomena became illegal, Grof switched to what was called holotropic, or what he calls holotropic breathwork, which is essentially intense hyperventilation used to alter consciousness. Very powerful, and you don't need to subject yourself to a drug that may take you in a weird place. All you got to do is breathe deeply for a couple of minutes and quickly, and you can very quickly alter your state of consciousness, or you can use any number of other approaches. So the idea behind all of these approaches that I've mentioned are to get an experience. I'm thinking of a Native American saying, the white person goes to church and prays to Jesus. We take peyote and talk with Jesus. The difference between the experience of the phenomenon directly versus learning about it. And this is where the transpersonal differs from, say, the psychology of religion. Recently, the Psychology of Religion and the American Psychological Association has broadened its title to become the Psychology of Religion and Spirituality. But almost all the work is looking at this from an objective, third-person perspective. But the transpersonal people who house themselves in the humanistic psychology division are much more interested in the experience, not just learning about the experience. And I'm thinking, for example, of Dr. Niemeyer's great talk right before mine, where he's talking about using narrative therapy to relive experiences and to recontextualize them. And that's wonderful stuff. But with transpersonal psychology, we would probably do more direct experiential things to get people into alternate states of consciousness to find meaning. And so there would be a slight difference in the shift. But clearly you can see the overlap. This leads to existential therapies. And I know a lot of people at this conference come from this particular perspective, from the logotherapy perspective, and there's a lot of debate among the transpersonalists whether the existential therapies are part of transpersonal psychology. And to me, it's a little bit of a hybrid. Existential therapies seem to get into transpersonal content when they deal with issues like embodiment, or when they get into issues like dealing with death, but it doesn't quite have the flavor. And I'll share a personal anecdote. When I was an undergraduate, I took a class on existentialism in the philosophy department, and our only textbook was Sartre, Being and Nothingness. And I remember reading that and feeling like it was just getting toward a precipice of meaning, but it didn't quite satisfy me. It just didn't quite. And then I also took some courses in Oriental religions and mysticism, and that's when I became a transpersonalist. It seemed to go a little bit further in the directions that I was dealing with as a radical student in the 60s and dealing with all the social unrest at that time in the United States, and also dealing with my own psychedelic explorations. So there are a lot of commonalities among transpersonal therapies, and I'm aware of time. We started 15 minutes later than the time allotted, so I'll just go over this very briefly. The focus on the experience, not studying about, but studying with direct experience, and helping one reframe whatever's going on in terms of the largest and the most inclusive context, and particularly challenging this issue that we're isolated individuals, but seeing our interconnectedness in very direct experiential ways. And also with transpersonal psychotherapies, that the focus is not just on dysfunction, but also on a more holistic picture, seeing what our purpose or place might be in the universe. One area that I might mention here is to help you conceptualize the difference between spirituality and transpersonal psychology. Even though spirituality has become very important, it's also resulted in a lot of people under the term spirituality promoting Christian psychotherapy and Buddhist psychotherapies and all sorts of religious parochial things. And there's an old saying, religions divide. Whereas spirituality is the common underlying. And transpersonal in particular tries to avoid parochialism by looking for the commonalities across traditions, so we don't get into a trap of espousing any one particular tradition, and then also taking this wisdom from different spiritual traditions and using it for therapeutic purposes in a more modernistic context. In terms of the scientific status of transpersonal psychology, as I mentioned, there's been a plethora of research on meditation, particularly mindfulness. It's just been all over the place in the psychology literature lately. But there hasn't been a lot of other scientific study of different transpersonal approaches. There's been a few studies on Groff's holotropic breathwork that looks promising. There's been a few case studies. But most of the people in transpersonal psychology, because they're so interested in the experience, are less interested in the science and trying to pin this down with objective ways of knowing, and I put objective in scare quotes when I say that, and I happen to be one of the exceptions because I'm very interested in doing research in this area. So in terms of problems in studying transpersonal therapies, I've listed a couple of these, and these aren't really so different from problems in studying any form of psychotherapy, except maybe when you get off the beaten path and you have to compete with parochial religious perspectives on what might be happening, it's possibly easier to get lost. One concluding comment I'd like to make is that all therapies can be transpersonal. And by that I mean if there's an attitude between the therapist and the person receiving therapy that looks at things in the broadest way, then that can be transpersonal. So if I'm working with an individual, even if I'm using the most simple operant conditioning and doing behavior modification, if I don't look at this person as a pigeon that Skinner might be training, but I look at this person as a biopsychosocial spiritual being that is complete and inclusive in this larger vantage, then even something as rudimentary as operant conditioning could be seen as transpersonal. For practitioners, there's a lot of cautions when you get off the beaten path and you start working with altered and alternate states of consciousness. It's really easy to get lost and confused. It's opening up lots of energies and scary things, and everything is not wonderful and romanticized when you start doing this. People can have horrible experiences. They can, and people are predisposed, as they say. They can have psychotic episodes. So when doing things like this, one has to be very cautious and make sure there's support systems in place, and to do it under a lot of supervision, not just start out trying to do transpersonal interventions. And I'll leave with this last thought. Does the personal matter? Can there even be a transpersonal psychotherapy? From a lot of spiritual perspectives, it's considered that the hang-ups that we have at the personal level aren't something that we should deal with. It's something we should let go. We should just go to a higher level. And to be messing around with our personal crap, if you will, is a distraction from the higher purposes of just meditate harder and get beyond it. So to use these technologies and these approaches to deal with human level concerns, does that even make sense? And that can be a case can be argued on both sides. But one thing that I'll give as a counter argument is all of the abuses in the transpersonal area. We all know of Catholic priests being pedophiles and the horrible church scandals. That happens in the East too, in the Buddhist monasteries, and there's all these cases of guru abuse, and so to rush forward to something higher and to explore the transpersonal has its hazards. And I think that's where psychology and psychotherapy has a real opportunity to make a difference, to bring balance. And the balance, in my opinion, would be between the personal and the transpersonal. So thank you, and I don't know if we have any time for questions, probably not. You can catch me in the lobby if you want to ask any questions.